What we're going to talk about today is infrastructure, but in order to do that, I wanted to set up a lot of what's happening around the country in terms of discussions about, is density dead because of coronavirus? What does this mean for smart growth, so that we can maybe have a more cogent discussion about how that impacts the infrastructure. So density, is it a problem? That's the first thing we're going to talk about. And then smart growth, and why smart growth needs to be part of this discussion, I believe, because of the infrastructure costs that can be controlled in some ways with different development patterns, and what impact development patterns have on infrastructure costs. And then finally, we'll have a section on how do we go forward, especially in the infrastructure part of this, to develop, to continue to serve people well and build resilient communities. So there's been a lot of discussion around the internet and around blogs about whether or not density is part of the cause of the spread of COVID. And while it's no secret that when more people get together, there's more likely to be people infected who might spread a disease, it's also true that really many of the very highly dense, both countries and cities around the world, have been able to reduce the spread of COVID-19 and the deaths. And so we're going to talk a little bit about why that is, and maybe what's different or not in the United States. So if you look at the United States, these are the 10 metro areas that have the highest death rates at this point. And it's not just the number of deaths, but the number of deaths per 100,000. And while 4 of those are quite dense, some of New York City is our most dense urban area, and Seattle and Detroit and New Orleans are among those. Many of the other metros on this list really defy the idea that this is a high density issue. For instance, Albany, Georgia, this was spread through 2 funerals. It didn't have anything to do with the density of the region. Then you read further and you find out that it's not just density itself, but the kind of density and the kind of place that you build as you're building density. So there are rich, dense places and poor, dense places. New Orleans is an example of quite a poor, dense place. So is Detroit. New York, on the other hand, is quite wealthy in the middle of the city. So Manhattan has a fair amount of wealth. But the interesting thing about New York is that the virus didn't start in Manhattan. It started up in Westchester County, which is probably the most suburban part of the greater New York, of the concentrated part of the New York metro region. And the places where it's hit the hardest are in the Bronx and the Queens and even Staten Island. And Manhattan has been spared in some cases from much of it. And if you look a little closer at what's happening, part of that is that while Manhattan is quite dense in terms of the number of units of housing, it's not a crowded environment. And some of those outer boroughs and outer suburbs have more people per unit, even though the units aren't quite as dense. They also employ workers who have a harder time working remotely. And if they're essential, they're still required to go to a job site, whether it be a construction site or a retail store, whatever it is. And those are places where even in a social distancing world, the virus can continue to get shared more quickly, more easily. And so part of the other piece of this is whether or not there's a correlation between where this place is. So New York and Seattle were some of the first, San Francisco, to see transmissions of the disease in the United States, not necessarily because they were dense, but because they were the landing spot for many of the people who were coming from countries where COVID was already quite prevalent. And so your cat is hilarious. Sorry about that. And so while it may have started in those places, that was because it was a landing spot. Seattle is another example of where the dense center city itself is not where the virus has been the worst, but in those outer ring suburbs, Kirkland, for instance. And then the death rates, if you look at those across the country, the death rates really aren't nearly as correlated to density if you look at them in a per capita basis. Obviously in Idaho, we've got Blaine County, which shows that both the infection rate and the death rate can be much higher per capita, even in a very small place than in a dense place. That's not to say that density creates more opportunities and sometimes easier opportunities for infection to spread, but density is not the reason that this infection is spread. And then there's the fact that urban places actually over time and across experiences are healthier places. People who live in metro areas live longer lives, they live healthier lives. There's a lot of evidence of this across all kinds of research studies in the public health world over the last couple of decades. And so while in this particular instance, having the infection rate potentially be higher in that urban region, there's also a better chance that you'll get better health care and have access to the essential services that you need if you're in that large metro area than if you're in a rural area. So why is it that people live longer, sorry about that, in an urban area? So let's look at some of those health and safety risks. Cities have higher infectious disease exposure because there's more people. There's a higher risk of the kinds of fires in which you might die, because if a fire were to start in a high rise, it's difficult to get out. There's more street crime. These are some of in the public health realm, some of the things that contribute to higher death rates in cities. But if you look at exurban and rural areas, there's many more factors. There's a higher incidence of chronic disease and less treatment. There's a much slower emergency response. There's a higher incidence of accidents and a higher incidence of suicides. Some of that may be correlated with the fact that many exurban and rural areas are a lower socioeconomic version than the cities around them. There's limited public health services in many of our rural areas. There's less access to emergency services. And in some disasters, they are the ones who are the hardest hit because it's very difficult to get to them and provide help for them. Then if you ask, what does this lead to in outcomes? So yes, the infectious disease risk is higher in terms of the contagion exposure in an urban area, but rural residents are more likely to die if they get infected because of the lack of health services. Urban areas have better health outcomes altogether, greater longevity. And if you look at the total benefits, urban areas tend to be more resource efficient and offer better economic opportunities than rural areas, which tend to provide benefits to their residents. So overall, most people are far better off during and after a disaster, including a health disaster like this one, living in an urban area where they have access to essential services rather than in an isolated rural area. especially if the infection does get to that rural area. And all of these are exacerbated both in urban and rural places for poor and minority groups. So what can you do to, I said that there were some cities around the world that were quite dense and dealing with this well. What kinds of things can you do to reduce the risks in an urban area? Well, you can target cleaning and sanitizing. Some of the transit systems, for instance, in Southeast Asia, are sanitized daily. They also have readers when you go into the station that takes your temperature, and if you're sick, they won't let you in. You can do other things to promote hygiene and promote physical distancing in places where it's necessary, like on transit vehicles. You can improve walking and bicycling, which allow for natural social distancing, and because urban areas usually have destinations close by, they actually serve people quite well. And you can eliminate homelessness and improve housing quality. In rural areas, there's lots that we need to do too, to improve public health services and outreach to households. High-speed internet is a real lack in most rural areas, so working from home can be a real issue in those places. And there are more poor and unemployed in rural areas, and the housing quality tends to be lower. What does smart growth do and density do for infrastructure costs? So we're going to talk a little bit, but not just hard infrastructure, also the social infrastructure. We're going to talk a little bit about that. This is a comparison of two maps in the Milwaukee region, or in the, in the Minneapolis region, Jill, that show that housing plus transportation costs are actually much higher in most of the rural area than they are in the city itself. And so infrastructure is not just what the public builds for everyone to use, but also the costs that you have to incur to use that. So one of the things that I've been intrigued by is this idea that cities provide an opportunity for sociable distancing, that sprawl and places that are very spread out are more isolated. And so this question of whether or not we should have more spread out places as a result of the pandemic, or whether or not this could prompt us to re-examine our assumptions about density in public space. Front porches are, this is a quote by a guy named Michael Mahaffey, who's part of the New Urbanism movement. And he likes to really talk about public space differently than most people do. He says that most people think of public space as just one thing, contrasted with private space, that the former, public space, is bustling, it's a square, it's a jam-packed street, and the latter might be your secluded living room or family room. But that duality sort of misses the complexity of what public space can really be. And he likes to use the example of the what he calls the lowly American front porch. I think of it very highly, but a porch can be seen as a marvel of sophisticated spatial relationships connecting from the public, the most public, which is the street, the sidewalk, that jam-packed space, to the most private, your living room, your bedroom. And so it's the in-between space where users can dial in the degree to which they wish to connect with others or not. And that capacity is really on display during the coronavirus, what he calls sociable distancing requires just that kind of physical separation that is afforded by porches, where you can interact with others but maintain a degree of separation, so you can continue to have the social solidarity at the same time you have the social distance. So I think that's an important thing. However we determined to create that in the world going forward, recognizing that it's an important thing to do, whether it be through front porches or other means. If you look at public policy and development, we have a lot of research that shows us that we make regulations and development decisions and infrastructure investments and the way we tax and the way we design roadways. Those in turn impact where households live, how much and they travel, how much it costs them to travel, and that ultimate impact is not just the housing and transportation costs, but also costs like traffic crashes and those air emissions that Jill talked about. It's interesting that road miles correlate almost directly with density. This is a number of miles driven. This is the number of road miles per capita in a region. The more dense places have many fewer roads and road miles per capita than the less dense ones, which means they have lower operating costs, they have lower construction costs, they have less impact from stormwater and other environmental impacts that go along with it. Conversely, those very less dense places, those places with the least density, cost the most to serve. Providing the roads, the utilities, the schools is much higher in those less dense places than it is in compact infill development. So again, going forward, if we want to build more resilient communities, how are we going to figure out to do that and still maintain what we need to make sure that we have good public health? There's other costs of sprawl. Housing has grown from almost 10% in the last century. Transportation went from almost nothing as part of the typical household budget to almost 20%. And this also impacts, individual budgets and impacts where people think they can live. So if their housing is very expensive and so they move farther out to get cheaper housing, then they spend more on transportation. So it's not necessarily bad to spend less on housing, but if the trade-off is higher transportation costs and higher costs in time to travel and higher costs in emissions and pollution, it may not be a trade-off that we've really thought through and should continue to make. And then there's the fact that sprawling places, not only do we build more roads in those sprawling places, but they're designed to what are called modern safety standards, and they're contributors to the majority of the US traffic deaths and injuries. This little chart is a study in California where communities that had roadway systems built pre-1950 versus communities that were post-1950 had a third fewer traffic deaths than those post-1950 communities. And this holds true for our large cities as well. Whoops. So can we do better? If you look at the United States, we're in the same range as Slovenia, and Belgium, surprisingly, is pretty high up there. But there are many other countries in the world that are lowering their motor vehicle crashes per 100,000 people. And both Belgium and Slovenia have made tremendous gains in the last decade, and the United States continues not to. So again, if you look at reasons to maybe think that we should continue to build more dense places, this would be one of those factors that we might think about. What changes are we seeing now, and what can we learn from them that might shape the future? So Jill, here's the discussion about CO2 emissions, and it's pretty dramatic. You know, we've heard for years during the climate discussion that those kinds of changes, those kind of dramatic changes are impossible. And certainly they come with a high price. And we found out with what's happening with the economy, but they're not impossible. China's emissions were down by 25% at one point. Overall, worldwide for the year 2020, it looks like emissions are going to be down by 5.5%. To put that in a little context, this chart shows the very bottom is the 2009 financial crisis. The next one up is the 1918 flu, the energy crisis of the 80s, the recession of the 90s, 1944, Second World War. And this event is going to be twice the impact of the Second World War on overall emissions. So, and the really exciting, if you will, talk about silver linings thing, is that because emissions are cumulative, it will have an ongoing impact. By being down this year, the following year and the following year and the following year will be less than they would have been without this decline. And you can see the decline in various sectors and in various places. The United States actually has the highest one as a percentage because our transport is so heavily reliant on personal vehicles and our emissions are so high. So this is actually something that I think is a place where we should be thinking, what can we do? We can't continue this same impact, but what have we learned that would allow us to say even have half this impact going forward? So I think that's something that I'm really interested in digging into a little bit more. So what's happening already? There are a lot of places that are recognizing as a result of the the fewer cars, the lower amount of driving, there's a lot of roadway space that's empty. If there's one thing we have from all that road building that we talked about earlier, it's a lot of roadway space, and we're not using it for cars. So a lot of places have taken it over for other things right now. You can see this is a bike lane, scooter lane, which is one of the things that's been happening. So let's see, sorry about this. I'm looking for a statistic here. Obviously, not everyone can't not travel in this time. We still have essential workers. Some of those are driving, but many of them are the lower paid workers that maybe don't have a car, don't have access to the same kind of travel that other people would. So these kinds of bike lanes are becoming essential for them to get to work, those essential workers to get to work. In some cases, it's flipping a switch. A lot of places have made walk lights automatic rather than making the pedestrian push a button. Other changes are a little bit more difficult, like this one where you have to figure out how to block off this lane and make sure that at the beginning and the end of it, people can get in and out. Transit systems are doing a lot to allow people to board in the back door without paying, and asking them to sit not next to each other, but in seats that are a distance apart. All of these things, some places are actually closing some streets and allowing just foot and pedestrian traffic on those. And the National Association of City Transportation Officials has come up with this list of both things that cities are doing and the priorities that cities are trying to meet with those. So obviously it still has to move essential workers and goods, keep frontline workers safe, allow them to get to their places of work, address pickup and delivery needs. But that middle one is the interesting one. Because of COVID, we're seeing crowded parks, crowded sidewalks, crowded pathways. And so these responses are actually allowing physical distancing by taking some of the roadway away from what used to be car space and giving it to these other users. So the question is, can we continue this? And that will be an interesting one as we go forward. So here are all the places that have, at least as of last week, had implemented some of these measures. Boise doesn't show up on here. The roadway measures haven't happened here. The transit measures have. There's backdoor boarding and no transit fares here. But these other cities have gone even further and done even more. Some researchers are speculating that this will be a lasting blow to transit ridership, which was already in decline. So I think that that's an issue that we need to be aware of and need to be aware of what we can possibly do to make sure that that doesn't happen. And so along those lines, various places are coming up with what transit agencies can do to make sure that that doesn't happen. So how do they bring back the confidence of their riders? Surely there's going to have to be marketing campaigns, but in addition, I think the transit agencies that can target their most impacted users are going to be best off, and you can do that by things like extending the free fares, at least for now, figuring out what are those essential businesses that those workers work at, and make sure you're serving them well, even as you cut back service in some other places. Make sure that it's restored first to the places that need it most, that have the riders who otherwise can't travel. And also, I think many people feel that this might also, instead of being a death knell for transit, be an opportunity to course correct our historic underinvestment in transit. The United States is far behind most of the rest of the world in our investment in transit services. And I think there's evidence that transit ridership can continue during events like this. If you look at especially Asia, if you build the right kind of transit, if you build transit that's well ventilated, that has good sanitation, that has these temperature gauges and other things, and if you ask riders to wear masks during events like this, transit use can continue and continue very safely. And if we can look at that, hopefully we can continue to rebuild our transit. So in 2009, we had the opportunity to look and see what a big infusion of cash in an infrastructure system might mean. So there was $26 billion infused all at once into the highway trust fund. And it was meant to create jobs above all else, but it wasn't targeted to jobs. And in an attempt to do things quickly, Congress defaulted to existing programs, and they were really not very well tailored for that task. So even with that $26 billion, the roadway system that we currently have is really in no better repair than it was in 2009. And you can see that it actually got less investment in repair during that era than it has since. So what that tells us is that most of that money went to new investment. It went to expanding new roadways and building new roadways rather than bringing the ones we already had up to snuff. So if we get investment this time, and there is conversation about that. So most of you know that there's been 3 different investments in COVID recovery so far. The last one being by far the biggest, $2 trillion. Much of it focused on small business, state recovery, and some other things. none of it was focused on infrastructure. And so there's now conversation going on that there should be another round and that it should be focused on infrastructure, and specifically that it should be focused on jobs. But as you saw with the 2009 investment, unless there's something specific in the legislation that requires that, it probably won't happen. So here's some things that we've gathered that would say if there is a phase 4 in COVID response and it's focused on infrastructure, here's the 3 things we think that it should focus on. The greatest impact on jobs would be require and repair. 16% more jobs per dollar spent on repair jobs than anything else. That's because repair jobs don't have the environmental work, they don't have the design work, they don't have the other legal work that might be required for a new project that really doesn't have very big return on investment in terms of dollars spent versus jobs created. And this would still be on the roadway system, but it would be on our current roadway system. And as we found, as some of it is oversized, maybe some of this repair could actually repair some of that. The next thing it could do is really invest heavily in transit. It might be that once in a century opportunity to flip the switch on how we get around, especially in larger urban areas, by making a heavy investment in transit and utilizing some of that unused roadway space for transit vehicles, making sure that those transit vehicles come often. So in the last response, none of the money was available for operations. It was only available to build things. In the transit world, operations are half the battle. And so we would need to make sure that operations were included as an eligible expense. And then finally, something I think near and dear to many of us, resilient cities we're finding include many transportation options. And we're seeing that the response to this pandemic is that people are utilizing walking and biking, particularly in favor of the social distancing and other things it provides to get around during this time. They're the simplest and least expensive things to implement as we repair our transportation system. And so again, we think that as this goes forward, we'd like for there to be a big investment in building a more resilient transportation system, which would be one that includes a lot of walking and biking.